Hi, I'm Ashley Waggoner, student physical therapist, and I want to take a few minutes to help you understand pain, the changes it can cause in your body and brain, and what it means when it lasts longer than it is needed. Pain is a complex response created by your brain to information about actual or potential tissue damage that it gets from your body. It is designed to alert you that your body is in danger. Pain can result from obvious tissue damage like a broken leg, as well as damage that occurs over time from things like poor posture or overuse. Pain can also result from emotional trauma. No matter what kind of pain it is, the brain is responsible for deciding whether something hurts or not. Pain involves your whole body, including your emotions, thoughts, beliefs, and behaviors. For this reason, the amount of pain you feel may not be proportional to how serious your injury is. Some people feel more or less pain with the exact same injuries. Even if you have no obvious injury, your pain is still real. There are two main categories of pain: acute pain and chronic pain. Acute pain occurs when your tissue is damaged, and it serves the important purpose of preventing you from doing further damage. This type of pain has a clear cause and is relatively easy to treat. Pain becomes chronic when it remains present after your tissues have completely healed. Chronic pain becomes the disorder rather than the symptom, and we need to treat it differently than acute pain. So how does pain work? The experience of pain begins when receptors in your skin, joints, muscles, and organs signal various dangers to your brain and spinal cord. About 1/3 of these receptors are only active when you have inflammation nearby. This increases your perception of pain after an injury because inflammation is part of the healing response. As your pain persists, these receptors may increase in number or become easier to stimulate, creating a larger pain response to the same perceived danger. These receptors only last for a few days, however, and then they're replaced with new receptors. They can also be made in larger or smaller numbers depending on your body's demand for them. Messages from these receptors travel along your nerves to your spinal cord and brain, and your brain gets to decide how it will respond based on the information it has received, past experiences, and a variety of other personal factors. Connections in your brain change in a similar way to the receptors. Connections used a lot will strengthen, while connections that are not used will weaken or disappear. It is good news that your receptors and connections in your brain can change. Both can decrease in the number and become less sensitive if we can teach your body to respond differently to the danger it perceives. Your sensitivity levels can change, and your pain can change. Chronic pain may lead to decreased movement or the fear of movement. Our goal in treating chronic pain is to retrain your brain and body so that it no longer creates a pain response to the movements that it did before. We do not want to do anything that provokes this pain response, so we take very small steps in order to decrease your body's excess sensitivity. This video is the first step in your treatment. Pain neuroscience education helps you understand what is causing your pain and decrease your fear associated with movement. Next, we will move on to motor imagery, sensory discrimination, mirror therapy, and eventually functional movements, but only when you are ready. These are all techniques to help replace the pain-creating connections in your brain and body with healthier connections that do not provoke pain. Thank you for taking the time to watch this video. I hope it helped you get to know pain a little bit better.